Congressional Democrats are gearing up to introduce legislation aimed at creating a universal single-payer healthcare system. Joining me now to discuss is Dean Clancy, a senior health policy fellow at Americans for Prosperity. Dean, thanks so much for joining me today.
My pleasure.
So let's just dive right in. What's expected to be included in this bill? And, with Democrats now in control of the House, the Senate, and the White House, is it likely to pass?
Well, what Democrats campaigned on was Medicare for all, which means a government-run healthcare program. But voters didn't really respond that well to it. They probably don't have the votes for that. President Biden ran on something called a public option, which would be basically a new government-run health insurance company that would, in effect, rig the rules to drive all the private insurance companies out of the market, so that at the end of the day, we would end up with a government-run single-payer system. That, too, is going to be tough to get through Congress. What's most likely to be in the coming bill is large increases in spending on existing government programs like Obamacare, Medicare, and Medicaid.
I know that President Biden just reopened or is planning to reopen that enrollment period for the Affordable Care Act. I believe that is February 15th through May 15th. It's about a 3-month period for people to have that special enrollment time. Now, Americans for Prosperity is encouraging lawmakers to adopt the personal option. Can you talk a little bit about that and why you feel it's a better option?
Sure. Let me just mention about that special enrollment period. They're doing it to get more people on the rolls of government health care programs. We think that's the wrong way to go. People need private choices and competition to bring down prices, improve quality, shorten wait times, and so on. And before I describe that personal option further, I should just mention the 4 reasons why Medicare for all or a public option is bad for America. Because it's bad for taxpayers, bad for doctors and hospitals, bad for patients, and because it won't actually be Medicare. It'll be more like Medicaid HMOs, restrictive care where you won't be able to see the doctor of your choice easily. So instead of that, we propose a personal option. That means guaranteed access, lower costs, more transparency, no negative surprises, and basically letting people make the choice of the doctor they want, the health insurance plan they want, and without government bureaucrats or insurance company bureaucrats telling people what they can't have.
Now, you just mentioned sort of these 4 reasons why you believe that Medicare for all is bad for a variety of different reasons. Are there any countries that currently have a system that's similar or is Medicare for all that is actually working?
Most countries around the world have some form of a government-run healthcare system. They differ widely from country to country. Most countries also allow some level of private sector involvement, and usually that's necessary for the same reason that in education you really need to have private schools, or the parents would simply rebel at being only allowed to use government-run schools. In countries around the world, the UK, Canada, for example, they tend to have longer wait times, poorer health outcomes on some measures. For example, in Canada, they do poorly compared to the US on cancer screenings. And it's because the government has gotten in charge of the system. So, it's you can promise everybody a free lunch. And in fact, that's what the Medicare for All bill does. It says you're going to have no premium, no deductible, no wait times. Well, it doesn't work that way. There's going to be costs. And unfortunately, those will fall on taxpayers and patients.
Now, millions of people since, the start of the pandemic have lost their jobs. And with that, they could have lost their employer-based, health insurance. With that in mind, is there any way to get these people insured who, lost their jobs by no fault of their own?
We need less red tape in the insurance market, less federal regulation, so that prices come down, so people have more choices and they can actually buy the insurance they want. Remember, the law that was passed now almost 11 years ago basically says you have to have Cadillac coverage, all kinds of benefits, even things that people don't really want or need, and it's very expensive. And that's why a lot of people hold back and don't pay for it because it's just too pricey. So if you could deregulate, have more competition, get the prices down, people would do better. And just one other thing, if you could let people spend more of their own money tax-free on healthcare, they could stretch their healthcare dollar further and cause more competition, bring down prices. And you do that through something called a health savings account. 30 million Americans have HSAs right now. Why not let 300 million Americans have them? That would inject a ton of healthy competition into the system.
A health savings account, can you expand on what that is exactly? It's actually one of the first few times that I've actually heard about, what that is.
Sure, a health savings account, it's a bit like a bank account, although you could also invest it in investments. The money is yours, but it's tax-free, like an IRA. But here's the difference. When you spend the money, you don't pay any tax on it, which is very different from any other kind of account. An HSA is the most tax-favored account in America. What it means in practice is you can get 15, 25, 40% discounts in effect on every medical purchase you make if you do it through the account, depending on your tax bracket. Basically, the idea is you can only spend the money in the account on healthcare. It has to be legitimate healthcare, and then you can do whatever you want. And that gives you so much choice. You can buy over-the-counter stuff. You can pay your deductibles and cost sharing. It's great. And the families that have it love it. But under current law, only about 1 in 10 Americans really have access to an HSA. We'd love to see that rise to 100%.
Just going back to the personal choice, the personal option, is there anyone, currently serving that is on board with this? Do you think it's likely that they'll actually, bring sort of that option to the floor for people to vote on?
There are a whole bunch of members of Congress who support the principles of choice and a personal option. Just to give you some examples, Congressman Chip Roy of Texas, who's been a leader on these issues. Just the other day, he introduced a bill to do what we've been talking about, to let every single American have a health savings account if they want one. And there are a whole bunch of others. Obviously, there are competing ideas in Congress about a more government-controlled system. And we at Americans for Prosperity are trying to persuade lawmakers that a personal option is a much better way to go.
Dean, I so appreciate you coming on to explain this. I feel like I learned a lot in the last, couple of minutes just talking this over with you. So I greatly appreciate it and hope that you'll join me again soon for any healthcare related news. So thank you so much.
Thank you. My pleasure.